Hello, my name is Dr. Leonel Reyes, and I am a family physician who practices here in downtown San Antonio for the past 30 years. And during this time, I've been involved with a lot of the population here in San Antonio, mainly around diabetes, hypertension, and cholesterol, the so-called metabolic syndrome. I found that many of the problems, the complications from diabetes stem from all of these components, and uh, trying to find a good, goal-oriented treatment for these patients is often challenging. So many times what I do is I use not only prescribed prescriptions for this, but in addition also some metabolic or enhancing type of products. Many times, many that are more natural and which can enhance the prescription medications. I've worked many years with Dr. Ingram with her formulations, and I've seen some very good results, and I've had other colleagues who treat the same patients, my same patients, who also have the same experiences. And I think the main thing that we always need to remember is one that Dr. Ingram repeats often, and that's wellness and prevention. And those are the keys to trying to get our patients through their disease processes to a healthy, more healthy life. I'm also involved in a lot of the hospitals here in San Antonio. I see patients not only in my clinic, but I do virtual visits, televisits, hospital rounds, and nursing home rounds. And in addition, I also serve a population in a personal care home where I see them at their homes. And in this way, I can bring them more of my expertise and experience, not only in prescribing medications that will help them get to a goal, but also help them to live a better life and a more meaningful life as well too. Have been, of course, affected by the COVID-19 pandemic, and here, unfortunately, as in other states, we are seeing rising numbers as we speak today. And I find that two things. One, I'm involved with Sun Research as far as providing a study outlet for patients with COVID-19. And what we do is we're using the viral antibodies to try and neutralize the process. And these are still products that are been passed by the FDA for the emergency use at this time in order to see if we can find a better treatment for them. And this involves the use of antiviral antibodies in a combination, sometimes with vitamin D formulations as well, to see if we can cut not only the amount of time, but also the significant symptoms that come with COVID-19. So mainly we're trying to address in these trials, these study trials, we're trying to get patients to a shorter infectious period of time and with less symptoms, less symptoms. In addition, we're on the cusp of the COVID-19 vaccines, which have just begun this week here in San Antonio, and I would highly recommend to everybody, all of my colleagues as well, to receive the vaccine, because this is the way that we're going to eventually be able to curb the whole pandemic here in San Antonio. The vaccines are being produced right now by two companies, and both of them I think are equally effective. There's some minor differences as far as handling and perhaps side effects, but overall both are equally efficacious, and I think that they will serve the public very well to prevent to end the pandemic of our COVID-19 disease. Well, being in family practice, I'm in the front line really of seeing patients with many of the complications from diabetes, hypertension, and of course strokes as well. The amount of strokes here in the United States are at an all-time high, or over close to 800,000 per year, and this is a very debilitating uh, process that will really affect not only the patients but many times the patient's family, and will sometimes involve years of physical therapy, of medication to treat the complications of the stroke. And I think the what we've been able to do here with some of the formulations that Dr. Ingram has is been able to help the response and to prevent, again, wellness and prevention, prevent some of these occurrences from happening. Uh, Stroke continues to be a high and a high high on the list of morbidities that unfortunately diabetics and people with hypertension continue to face. I have taken the D formulation. I think fortunately I've been, I guess I don't want to boast, but I've been blessed with good genes, so I don't really have a lot of the problems that some of my patients have. But vitamin D deficiencies are pretty broad, broad spectrum, and you'll find it quite often, and that's where I think that a lot of prevention again and wellness can be obtained. But each person is different, and you have to tailor each of the person's medical condition with a formulation that's right for them. And this is what I found that Dr. Ingram has been able to do, is really to tailor to each person individually according to their needs what would be a good formulation for them to take. Well, the population mainly will probably better be defined by an examination in laboratory to see which of the elements that may be deficient, because there are many naturally occurring elements that may be down, magnesium, homocysteine levels, vitamin C levels, vitamin D levels. All of these go into the picture of what exactly would be appropriate for replacement. And I've seen Dr. Ingram very meticulous in the laboratory tests that she runs to be able to determine what exactly is lacking and create a personalized recipe, if you will, to be able to correct those.